in there, and the wound on the
That's probably about right.
That's probably about right. So you have to absolutely verbalise what you're doing at every point. So we are very clear that you understand why you are doing it. So this is just the basic. So what's the acronym that we begin with?
Viper.
Okay, so what does it stand for?
Hand wash.
Yeah, you don't actually wash your hands, you just go through the motions of washing your hands. Because you're going to be touching them, use some alcohol gel and so.
Yeah.
And then what's next? Introduction. Okay, so my name is Charlotte, I'm going to be your nurse today. Can I just get your name and date of birth?
Jovi, 27 episodes.
I'm just going to ask you a couple of questions, Joey, and then do an examination. Is that okay?
Yes.
Fantastic. For the purpose of this, I'm going to be exposing her tummy, the E. I won't do it straight away, but I'll need to do that when I lie her flat. Okay? And you could say that as you go along. Reposition. Positionally for the history, she's fine, but as we go on to examination, she'll need to lie flat. Okay? So then you start off with maybe a 30-second global survey. Don't do any more than that. It's enough just to say, okay, so I'm looking at the patient. There's no obvious signs of jaundice. No signs of any sick balls, ancillary oxygen, she looks comfortable, she does not look in distress. I will now examine the patient, okay? Go forward. If you don't remember to introduce yourself and get the patient name, that would be a fail. Global survey, take it or leave it, have an attempt at it, say something, but if you don't introduce and gain consent, that would be a fail. Okay? As an absolute minimum, because it's a safety issue, okay? So then we are going to, I'll keep you sitting up for the time being, and then when I come to the tummy, I'll lie her flat to do her abdominal examination. So we start off with the fingers, and what are we looking for?
Looking at kid.
Yeah, so comment on general pallor.
Yeah.
Well perfused, not well perfused, yeah. This patient is very well perfused. Today she's boiling. She's on fire, in fact. So signs of colonychia, leukonychia, turning the hands over, you're looking for signs of palmar erythema, which is a sign of what? Potential endocarditis, also long-term chronic liver disease, yeah. Dupuytren's contracture, it would be very obvious. Once you've seen it, once you see it you see it every time. It doesn't necessarily mean it's a GI problem because it can relate to other things. It can just be a congenital issue. But once you see it, it's like a malformation. You would recognise it. So looking for signs of Dupuytren's contracture. You can have a quick feel for the pulse. Paul Silverton said it was always good practice just to feel the pulse, even if it's not respiratory cardiac, just checking for regularity and strength. Okay, so you can make a note to that. And then we're going at the body. And where do we start off with at the body?
Eyes.
Face. I would go face and then move down. Okay, so what are you looking for in particular with the face?
You're looking for anemia.
So you could get the patient actually to drop her own eyelid. People don't want to be touched. I hate it when people touch me. So you could say, if you could just pull your eyelid down for me, looking for signs of anemia, any sort of jaundice in the whites of the eyes. Yeah. You could also comment on the presence of fatty deposits and plasma. Why not? I mean, it's a cardiac sign. But if she has a lot of fat in her diet, there are issues with fat in the blood. They may well appear. Yeah, high cholesterol, cholesterol, etc. You may well see them. Okay, but again, they may be signs of something else. You're just commenting on the presence of them. So you've done the eyes, and then you're moving down the face. And what are we interested in? We're not commenting on nasal flaring. That would be respiratory. Not interested. Hydration status, mouth. So if they're wearing a mask, which they might be on the day. In fact, we're all meant to be wearing masks today, I think. But bring one on the day.
So do we need to mention that we need to wear PPE?
Yeah. Okay. Just mention it. So get them to drop it. Look inside the mouth. Get them to stick their tongue out. Yeah. And look for hydration status. You could also comment on the presence or absence of stomatitis in the corners of the mouth. It's a good sign of nutritional status, any deficiencies. And any issues with hydration. And then we go around to that, and as she's sitting up, you can get us to sit slightly further forward, and then you're just going to examine for lymph nodes. Somebody asked me if you need to name them specifically. I would just say I'm going to examine for the submandibular, moving around the line of the jaw,
the posterior,
pre-auricular, post-auricular, round to the back.
Sorry, I'm wet. I'm sweating.
And just looking for any obvious, and I would say looking for any obvious swelling. As a sign of infection. Yeah. Respiratory and abdo are the two systems I would tend to include it. Okay. If you're doing it, I think it's helpful to say what you're looking for. You know, you may not know precise names, but I think just locationally to say where your hands are palpating. Do you agree with that?
Yeah.
Any more detail needed?
It's fine.
I think it's
If I
sufficient.
identified, I think they could, go with the exact.
If it were, you know, you're having this signed off within your practice assessment document, practice it with your assessor and just say, look, this is what I'm going to need to demonstrate. Can you just tell me what the main ones are and how you would do it? Because he'll sign you off on that. That's enough to get lymphatic system signed off. You don't need to keep doing it. You just need to have a discussion with somebody about it. Okay. And then we're going to palpate the Virchow's node, and really, it should be enough visually to see it. I am now looking for Virchow's node, okay, which is a sign of GI cancers. Okay, it would be very obvious if you see it in somebody's left shoulder. It's like an egg. It's a shape of an egg. It's very obvious that swelling, so you would see it and be very obvious. In which joint is it? Do you find it? Sternomastoid, clavicular. It's on the crib sheet. Sternum. What does it say that again? Sternoclavicular, that's it. So you would, it's like, it's a joining, if you like, within them, but it would be so obvious if they had it. But again, for the purpose of the basic OSCE, you're just referring to the fact you would look for it, you know why you're looking for it, and you know where it is. Okay? So we've done the neck, and we've looked for the Virchow's node. And then we're going to move down the system. Now I need to flatten this lady, and if you don't flatten them, that will be a fail. So you must flatten them if they're not already flat.
What about the spider web? Do we need to
Spider nevi?
spider lever?
Yeah. So we'll do that on inspection.
Okay.
So you'd comment on the presence of spider nevi on the chest. They're very obvious again, once you've seen them, they're like broken veins effectively on the chest, very obvious. Why does somebody have spider nevi?
Will it be liver disease?
Yeah, I'm still happy to answer this. That's it, okay. Okay, so first of all, we're going to inspect, and what we're looking for. We've done spider
Scar.
scarring from previous surgeries. They may have had an appendectomy. They may have had gallbladder removed. They may have had a C-section. C-section, sorry, yeah. Obvious distension. Masses.
Ascites.
Absolutely. Could be a hernia. Yeah. And at this point, they will have told you where the site of pain is. So whenever you are physically examining them or palpating them, you need to work away from it. So you work from the least painful area, working towards the area of pain. Okay, and then you can start to assess where it potentially originates, whether it's radiating anywhere. Okay, so that's really, really important. So on inspection, we've inspected for those things, and then we're going to auscultate.
Yes.
I would do. So it's IAP as opposed to IPA, just for this system. Yeah. So what are we listening for?
Brown sign.
Yeah. You don't have to make a big song and dance of it. One side.
Both sides.
Correct. And then what else?
And the epigastric.
Aortic bruit. And
Aortic.
just say it. Just say I'm listening for aortic bruit. Because on inspection, if someone had a AAA, you would see this very obvious pulsation. You would know it was there, but you need to then follow it up with a further check, I would say, just by listening. Because if you start palpating immediately, you can cause death with someone in a query AAA. Okay, so it's really important. So then you've listened. And then we are going to palpate the quadrants, aren't we?
Yeah.
Of the stomach. What you should be doing is just palpating very lightly for AAA. Yeah? Have people been doing this at work?
Yeah.
Are you comfortable with it?
Yeah.
Just describe it to me. One finger either side.
Yeah.
And what are the measurements are you looking for? What's normal? Anything really more than 4, I would say, would be abnormal. But you would see an obvious palpation. Okay, so again, I think you're demonstrating that you know where it is, you know how to palpate for it, and you know what the measurements are. But just make sure you do learn those parameters for it. Okay. So then we're going to palpate, and say the pain was on this side, lower left. We'll start at the lower right. Okay. So I'm just going to palpate. Tell me if that's okay. I'm going to go around lightly and then repeat it just more firmly. Okay. This is me just lightly doing it. So it's not so much a wave, is it, at this point? No. And don't forget the sort of pubic area as well. Make sure the trousers are low enough that you're going deep enough in to the iliac fossa. Right, so that's just lightly done. Okay, and then I'm going to repeat that more heavily. Okay, just 9 quadrants, more heavily this time. Okay, umbilicus. Into that area. Right. That's fine. And what do we do next?
We palpate the liver.
Palpate the liver. Absolutely. I would stay with palpation until you finish it, then move on to percussion. I wouldn't go palpate, palpate, because you'll forget. Okay. So then we're looking for the location of the liver. Okay. And when do you get the patient to breathe in and out? Okay. So just breathe in for me, and then breathe out. So in theory, when you're at the liver edge, or where it should be, you would feel the edge of it tapping against your hands on expiration. It's unlikely, unless I've got a massively enlarged liver. It will be normal in most people, yeah. It's only if you know they've got a known diagnosis. But it's important to be able to demonstrate that. Okay. So that's your liver. And then we're going to do the spleen. And again, what are we looking for with the spleen? This is, I guess you're looking for tenderness in that region.
Tenderness.
Would you feel an enlarged spleen?
Not really.
I think it would be very difficult to feel that, but you'd be able to confirm a site of tenderness. I think it's about the tenderness in that area.
Yeah.
Therefore, if that's a clinical picture and they've got a bit of a temperature and it's very uncomfortable in that area, are you thinking maybe we've got some kind of infection there? Yeah. Done the spleen. So now I'm going to palpate the kidneys. Yeah. So hand under. And where do you place your hand underneath?
On the mid quadrant of the stomach. And
What's the actual location for it? Yeah, really vertebral angle. And so you cup your hand round, and you're literally trying to cup the kidney and feel for any changes in the surface of the kidney. Again, unless they were massively polycystic, hugely swollen, the patient hadn't passed urine in days, was very unwell. You know, they were in like an end-stage kidney. I don't know how much you would feel, but anyway, it's theoretical. So again, same side. You could cross over to the other side and cross to the other side of the bed, but if it's possible, do it on that side. Okay.
I've
Just
seen
for
it
ease.
quite bigger in one patient. He had chronic stage 3 kidney disease, and I think he called for pain. And when we went
Did you see it?
yeah, it was quite bulky and very like.
Right.
And when you palpate, it was so painful. So
It can be useful. A lot of it is theoretical, but when you get a patient like that, you realise why they do it, because it's another layer of examination that on ultrasound you would then confirm, but it's just a way of taking the first steps towards doing that. So you've done the kidneys, you've done that, and now we're going to percuss. Okay? And again, people can use the edge of their stethoscope if they wish. That's fine. I think it's useful. It's clearer, nice and opaque. Yeah. Again, go low enough. Yeah, when you're doing it. Okay, and then we're going to do the liver, which would correspond. You see that you hear the change in resonance with that, yeah. And again, we'll do the spleen. Transverse. Yep. Slight. So again, is it the spleen? Is it the liver I'm hearing? No, but we know the organs are there, and that corresponds with the anatomy and the way we'd understand the underlying anatomy. And then we do a shifting dullness. Yep. So for this, we just move up the body transversely, get to a fixed point, get them to turn towards me. That's it, lovely. And in theory, if there were fluid, there wouldn't be in the basic, but if there were, if you followed the pattern, you would effectively hear a change in resonance, okay, because the fluid is shifted. Okay. Or you've got a fixed point there, so you could work your way back up again to it. I think it's work your way down, because you would hear the fluid changing. Yeah.
And it would be a bit more sort of lower sound rather than higher.
correct, because of the density of fluid. And then last check, I guess, edema. Is edema on there?
Nice in there.
Yeah. So, as the patient is sitting up, not ideal. You could have done it earlier actually when she was sitting, but you could take a quick look, any obvious sign of swelling, quick feel for sacral edema, and you could look at the ankles and just say, I'm also going to check the ankles because I would do this at work. And that's it.
Thank you.
Is that right?